Hey, what's going on, everyone? How are you guys? Hope you're doing well. Let's see. What's going on, Lindsay? Tammy, how are you? Carol? Mary, Joni, Tyler, what's up? Layla, Lasma, Jolie, Diane, welcome tonight. Welcome. My name's Zach Ramid. Kay, how are you? I'm a third-year anesthesiology resident, veteran, former EOD guy. Trying to get national PTA stuff done. PTA, what is PTA? Parent Teacher Association? My youngest is 5 and had low-grade fever for 3 days. Should I be concerned? Brittany, what's a low-grade fever? In your opinion, what's the number? Give me the numbers. Numbers. 99 to 102. So 102 is a fever. So that's not a low-grade fever. That's a fever. Low-grade fever doesn't have a real term. If the fever hasn't broken in 3 days and he's still occasionally reading a 101 or more, I would consider taking him in. I have no idea any other symptoms, but just on that alone and on age, worth going to the urgent care for sure. Oh, nice. Hey, everyone. Hey, user 9618376667892. I love these unique usernames, guys. What's up, Hides? Thank you so much for the kind words. I hope you're doing well. Right now, I am responding to a comment, actually. Why are you shaking, Owen? Don't shake. What's up, Melanie? What's up, guys? All right, trivia question. You guys want some trivia questions? What year was the first Major League Baseball World Series? I have no idea, actually. So you guys could say anything you want and be like, yeah, that's right. That sounds right. So I do anesthesiology. I put people to sleep, but more importantly, I wake them up. It's one of the, in my opinion, truly one of the best jobs in medicine. I love it. It's hands-on. We get in many ways, save lives. It's so fun. Do you ever sleep? I don't sleep. That's a side effect of residency, is no sleeping. I definitely don't sleep as much as I wish I could. And by the way, red flags that we need to talk about, guys. 1964? Seriously? No, there's no way. The college or the World Series had to have been before 1964. Oh, guess how old I am. I'll give you a hint. I'm older than 18 and I'm younger than 60. And if anyone says over 50, I'm banning you instantly from the live. Got accepted to NYU Dental. Also have the choice to go through a dental program for the Army. Which one? Only join the military if you want to serve in the military. Do not do it for the money. It's not worth it. 29. I like that, Melanie. Think 40s. Okay, 40s, you're banned. 41, you're banned. 39. Okay, Judy, I won't ban you. 37. That's not bad. 34. 27. Rochelle gets a promotion. She said I look 27. Rhonda gets a promotion. She says I look 28. 29. But the first person who got it was Cat Lover. I am 33. 33 years young. 33 years young. And you guys should watch my video where I use that old person filter. I thought it was funny. I don't know. I am a baby. I'll take that. I'll take that as long as I can get it. My doctor's a DO and tells me not to go to the ER when I actually need help. Ooh, let's dig into this, guys. How many of you have been to the ER and waited a long time just to kind of be told, like, hey, nothing's wrong with you. Carry on your merry little way. Carry on. RN, same age as my daughter. Love it. Me. Hello, Lisa Marie. How are you? The 40s was the baseball question. What? Who gave me that? That is so cool. I don't even know what that was. That was so cool. Hang on. Teresa sending the flying jets. I love it. I had a gallbladder attack that tried to convince me I was an alcoholic. Oh, that's crazy. Well, Cece, and I'm not saying you're an alcoholic by no means. I'm not on their side. That was so cool. The Jets. But I do believe there's an association with alcohol use in gallbladder disease. And I'm not saying that you have alcohol use disorder by any means. No. I tough it out, no ER. So this is a very universal experience, guys. By the way, if you're curious, I'm live on Facebook and on YouTube at the same time. I'm also live on TikTok. So any of you guys on any of those platforms, I tend to interact more with TikTok because there tends to be a lot more viewers there. Just FYI. So where are we at? ER. You go to the ER, you wait for 2 hours, and you get put in a little tiny room where you wait for another hour. So you go from one, waiting room to a smaller waiting room, but you view that as a promotion. You get excited. And then finally the doctor sees you and they say, all right, we've ran some tests. Maybe we've done an ultrasound. Maybe we've done a CAT scan. And you're fine. You're free to go. Here's what the ER is for. The emergency room is to make sure that you're alive, to make sure that you're not an imminent threat, no eyesight, no limbs, nothing that's going to make you worse within a short time span if you leave, to make sure your vitals are okay. I do anesthesiology. I'm a third-year anesthesiology resident. And making sure you don't have infections that would get worse, right? That's kind of what they're there for, making sure you don't have massive brain tumors that are causing your migraine or strokes. They are there for emergencies. And oftentimes we have these collection of symptoms that to us feel like an emergency. I get it. Literally, I woke up 2 days ago and I couldn't walk. I was bent at like a 30-degree angle, walking like literally an old man. And it was so painful. I've had these kind of, through my back out, I have this bulging disc and like, you just can't walk. It sucks. But unfortunately, like I didn't know this, actually, this happened to me before I was in medicine. And I remember going to the ER the first time it happened, thinking, God, it's an emergency. And it wasn't, everything was fine, right? So unfortunately, a lot of things that someone who hasn't gone through intensive medical training doesn't understand, myself included, I didn't understand this. It's better suited to go to either an urgent care or a primary care doctor, especially primary care, because then primary care can get you into the specialist for your gallbladder, for your liver. If you are having severe back pain that's debilitating, can get you in to see a chronic interventional pain specialist. They can get you in to see a neurospine surgeon, orthopedic spine surgeon. They can get you on the pathway to getting interventions that could help you. Um, our system is broken. Our system sucks. There's no good way to go about this. And I know you feel like you get the runaround. The ER says you're fine. And to them, you're fine because you don't have an emergency. And then your primary care says, I don't know what's going on. Let's send you to the ENT. And the ENT says, I'm not sure why you have that sound in your ear. I'll order you an MRI and a CT scan. We'll let you see neurology. Neurology's like, I have no idea. CT scan, there was something there, but could be normal. Let's send you to neurosurgery. And then neurosurgery's like, this isn't a neurosurgery problem. Let's send you back to ENT. I get that. I've seen that. It sucks. Oh, thank you, Jessica. So I just rambled. Other questions? And I don't even know if I answered your question. I don't know. I had an SI injection and it caused my left leg to go numb from the knee down. Went to ER per doctor. SI injections, sacroiliac joint injections, definitely unusual for you to go numb from your knee down. I'm kind of surprised they said I felt like a CYA call, go to the doctor. Is this pro-holistic or anti? The wording is confusing. Let's be very clear. I got a little banner on my TikTok. It says holistic red flags. I'm a very much pro-holistic physician. If you don't need a medication and if you eat right you eat natural foods without preservatives, vegetables, and you exercise and you sleep well in your spiritual health, you have faith and you're taking care of yourself spiritually, I think that most things that will you will feel much better. You're going to feel much better. You're going to sleep much better. You're going to be much better. So from that standpoint, I am absolutely holistic. From the standpoint of, I think medications are poison, that's not true. All right. Medications aren't poison. Well, kind of a caveat. Anything's poison in the right dose, including water. So I have this because there are some red flags. There are some things that you need to be aware of that if someone says it to you, you're like, oh, wait, are they selling me something? Is there a financial conflict of interest, etc.? So Cher Farrell says, what's the best way to detox the liver? Thank you so much for the gift, for the rose. I appreciate it. And let me tell you what, the holistic industry is filled with people who are confusing their credentials and using the term detox. So there are only a few routes of elimination and detoxification in your body, and that's through the liver and the kidney. There is very minor elimination in other routes, such as you breathe out certain things and you sweat out certain things, but you can't sweat out much. Your body has a very tight regulation of what it allows to sweat out. So really, it's what you're pooping out, it's what you're peeing out, and then it's what your liver is breaking down, and then eventually shifting it to either your poop or your pee. So holistic providers that say, I'm going to put you on a 30-day detox and we're going to get all those toxins out of your body. Okay. And then and here's what they're going to say. They're going to say is your brain controls everything in your body and the nerves from your brain go down your spinal cord and your spinal cord sends nerves to your GI system. And so we're going to detox your body. We're going to cleanse you. We're going to get all the chemicals out. And then if you buy a 4-month package and you get an adjustment with me, twice a week for these 4 months, I'll realign your spine and I'll unpinch those nerves so that your GI system can work better. Those are all red flags. Okay, red flags. You shouldn't be buying packages from people. Care should be given when care is needed. I shouldn't be preemptively selling people on care. You can't unpinch nerves going to your stomach. That's not a thing. And if we're trying to detox chemicals and they're not telling you the route of elimination and what chemicals you're detoxing, it's a red flag. Type 1 diabetic, severe dehydration from vomiting and diarrhea daily for months. No doctor knows why. Lisa, if you are severely dehydrated and you continue to vomit, etc., that is a reason to go to the emergency room because dehydration can be lethal in some instances, especially when you have type 1 diabetes. But if you're getting by, you're keeping some stuff down, you're just mildly dehydrated, definitely follow up with your endocrinologist. Maybe see a GI doctor, but also make sure that your primary care doctor is tuned into all of this and helping coordinate your care. Your primary care doctor will be the person putting the puzzle pieces together to make the big picture, right? So milk thistle and dandelion root. You guys asked about those. Honestly, I don't know. I'd have to look into the data on those. I have a playlist called Inflammation Series on my TikTok, and you can kind of see some of the more natural supplements that there is good evidence for inflammation, pains, things like that. Is general anesthesia safe? I'm 18 and scared I'll unalive. So in general, guys, I do anesthesia. I love putting people to sleep, and more importantly, I love waking them up. I love getting them through surgery safely and without pain, and I love helping them in the recovery area avoid pain. And I will say, in general, anesthesia is safe for most people. It's not safe for everyone, and it really depends on the surgery as well. But in general, if you're 18, you have no health problems, it's safer than riding in a car. Every time you step in a car, you usually accept more risk than you do going to the emergency room. How can I trust the medical field? No offense. I got into severe panic attacks when I have to go to the ER or admitted. At this point, I don't go unless my blood clotting disorder is attacking me and an ambulance has arrived. I had a traumatic experience. You know what? I think since 2020, since the COVID pandemic, We have lost a lot of faith in our healthcare system. We could talk about that forever. I don't know. But one of the things I'm doing to help combat that and to hopefully build trust back into the healthcare system are TikTok lives, streaming on YouTube, streaming on Facebook, posting PSAs. I'm a normal human. I grew up super poor. I was in, family had a cycle of addiction, abuse, violence, all that stuff, in and out of foster care. I was first gen high school grad, first generation college grad, and first generation doctoral grad, right? Probably I am the first person, I'm the only person in my immediate family not to go to jail or prison. So, I'm a real human. Big Pharma has never sent me a check. I'm a salaried physician, so I don't make money to do procedures or to do anything. So I don't have a financial conflict of interest when I'm doing these things, right? So that's what I'm here, is to hopefully build trust, help you guys build trust back in the medical system. Is it bad that my heart rate is 192 in jogging? What does this mean? Salem, that could be okay. You'd have to calculate your Google search target heart rate range, see where that is for you. 192 while you're exercising, if you're young and healthy, isn't terribly scary. Doing that for very long, sustained periods of time could be. Heel pain for 2 months, stretching and flexing foot. Is this helping? What can I do? Yeah, so for one, I'd recommend seeing a physical therapist or a sports medicine physician. You could have plantar fasciitis or several other things going on. You could have muscle strain injury. You could have a stress fracture, lots of things. Not medical advice. I'm not telling you you have those things, okay? I'm telling you that you could, those are possibilities that someone with those symptoms could have. Jennifer, hi, AFE survivor. I would love, if you stick around, Jennifer, I'd love to maybe invite you on as a guest and you could tell us your story if you're interested. I don't want to pressure you, but it's very fascinating. For those of you that don't know, someone said I was the fakest doctor I've ever seen. How flattering, truth seeker. I'm so flattered that I've broken a record in your mind. But yeah, Dr. Phil and Dr. Oz are the real OGs here. But AFEs, amniotic fluid embolisms, you guys have probably heard of those in recent news. There was a famous social media influencer who had her struggle with infertility, finally got pregnant, and then, unfortunately passed away due to an amniotic fluid embolism. There's no way to predict who's going to have one. There's no way necessarily to prevent it. We don't know actually a whole lot about amniotic fluid embolisms. It's still a little bit of a black box for us. We have ideas and theories and stuff, but it's too rare. It's rare diseases are hard to study. But Jennifer on here, she is a survivor. She had an amniotic fluid embolism and survived. So in order to sue a physician under medical malpractice, this is something that people get a little confused about. You have to prove to the court or to the jury. Thank you so much, Jackie, for the hat. Looks good. Damages, right? So Truth 007 Seeker, you threatening to sue me for my medical advice that I said I'm not giving. This is just general education. You'd have to prove to the courts that what I said damaged you. And one of the best things about most of my statements and comments, they're evidence-based. And they usually provide more benefit than harm. So I don't mind sharing what state I'm in. I'm in California. Does cayenne pepper help thin the blood? I'd have to look that one up, but I can look it up. That's an easy thing to look up. I'm not familiar with it being one of the ones that thin its blood, but I'm not saying it doesn't. Let's see. Cayenne pepper. Does it thin the blood? I think one that does is ginger. Maybe the pharmacist therapist knows. And by the way, if you guys don't follow the pharmacist, you should. He's on here. Drops some good medical knowledge. Cayenne pepper does have some blood thinning effects, primarily due to its active component capsaicin. Oh, fascinating. I did not know that capsaicin had blood thinning properties. It does inhibit platelet aggregation and thromboxane formation, so kind of like aspirin. Asking about the blood thinning properties of cayenne pepper. It exhibits antiplatelet activity in laboratory settings. There's no established role for cayenne pepper as a blood thinning agent in clinical practice. It should not be considered a substitute for antiplatelet coagulation. Yeah. So it does seem like there are some theoretical blood thinning properties to cayenne pepper. I hope that answers your question. Here you go. It seems like you're doubling up. This is essentially based off of what this says, and there's no medical evidence to prove this per se, like no randomized controlled trials, but it seems, I don't know how effective it is at inhibiting platelet aggregation, but by taking aspirin and cayenne pepper, you're kind of double thinning. It's kind of like a double dose. So, I mean, talk to your doctor about why you're taking the aspirin. There was some changes in the guidelines in the past couple of years, and it may not be the most beneficial. Talk about there's a scoring system called the Has Blood score, and it stratify it. God, I can't speak. It tells you what your risk is of bleeding, and then the ASVCD score, like a clotting score. Well, that's for AFib. But there are other risk calculators tell you how likely you are to clot, right? And you balance those out. Oh, cool, Jennifer. Love to have you on. Beets. One good supplement that I will recommend everyone take for many, many reasons is fiber, actually. I doubt that of the 150 of you on this chat, I doubt more than 10% of you are getting enough fiber in your diet. Hi, Morgan. My night's good. Yep. Warfarin's used. Absolutely. Fiber. Fiber supplement's really good. It's obviously good at reducing your risk for colorectal disease. It helps with IBS. The other thing it helps with that I recently learned from my wife, who's a pharmacist, is it can reduce your average blood glucose or your average sugar level. So if you're diabetic, it can reduce your A1C by up to half a point to maybe a point, which is a huge, huge gain. Some diabetes medications don't even work that well. Love the stickers. Sandy, good evening. How are you? So excited for you, Star. Now, so Morgan said fiber backs her up. So when you consume fiber, you have to make sure that you're consuming enough water too. I believe the most recent guidelines recommend 30 to 45 grams of fiber a day. Let me double check that. I'll look up the guidelines, but 30 to 45, somewhere in there. Fiber pill, I don't have any. I don't think there's a lot of good data recommending like which form of fiber per se, but so probably whichever one you like. I have actually taken fiber gummies. It definitely impacts me. Yeah, so optimal health is 25 to 38 grams per day. Clarifying there. 25 to 38 grams per day for fiber. Oh, hey, by the way, not medical advice in that sometimes fiber, depending on certain medical conditions and medical diseases, is not appropriate. So if you even remotely think that you have some sort of disease that might make it difficult for you to consume fiber for some reason, definitely don't take it. Like not having a colon, things like that, having severe diverticulitis, et cetera, et cetera. So why did I choose anesthesiology? I actually started off, I wanted to do physiatry, PM&R. Then I wanted to do urology and then ENT. And then I matched into general surgery residency that I was going to be a surgeon. And I loved, to cut is to cure. That's the saying, right? And in so many ways, it's 11 p.m. and I'll be feeding the baby around 1 a.m. Maybe like 10, 15 minutes. Jennifer, how does that sound? So I loved it, but it was so many hours. It was a lot of hours. It was a lot of hard work. The pay was the same or less than anesthesia, and a lot of my colleagues were burnt out. They weren't happy. It was stressful. You take your work home with you all the time, and anesthesia is very enjoyable. It's hands-on. You're helping cure. You're running code, saving lives. Doing all the things. You're working in the ICU. I'd say less stressful than being a surgeon. Better work-life balance. Better pay. And when my patients are sleeping, they're not yelling at me. which is good. That's a perk. Hi, Ashley. How are you? Oh, yes. I would, if I was missing my colon, I would also be sad. Hi, Sue. How are you, Sue? Who all is in the medical field? Any medical field workers? Any nurses, CNAs, EMTs? I started off as an EMT. I work until 7 a.m. Ooh, you're on night shift, Ashley. Spinal fusion, and it hurts. How recent was your spinal fusion? We got a nurse. Ashley's a nurse too. Sandy, are you a nurse as well? Yeah, nurse. Yeah. Tina. Asleep is good. Can't hit you spit. Yeah. RN. What kind of RN are you? Apple user. Thank you, Hides. Hides, you're a nurse too, right? Medical assistant. Love it. CNA, med aid. X-ray, CT tech. Contemplating. You should definitely retire. Do it. Vangie. What kind of nurse are you, Vangie? Angie? Vangie? I don't know how to say that. Health insurance. But were you a good person in the health insurance field? Was an MP, now psychologist. Oh, love it, Sandy. Yeah, it's all coming back to me now. Just to want to be doc from the tick trolls. English teacher in Argentina. Wow, that's cool. Angie with a V. Oh, the V is like silent. Love it. Neurosurge. Love it. Anyone interested in going to medical school? Texas. I love Texas. No income tax down there. I do like the Galveston area. The coast area is really nice. Thank you. Thank you, Brooke, for subscribing. It's so kind of you. If you guys are interested, I do after my lives, after I chat and talk with everyone, we do subscriber only chats. And I'll post some occasional subscriber only videos. So like Brooke just subscribed, so I appreciate it. I think Brooke subscribed in the past too. I think she's resubscribing. Thank you. Medical school, just trying to finish my bio degree. Love it, Philly. Best of luck, man. What are you trying to do? You're welcome, Tina. Epidural steroid lumbar injections, IV sedation. All right, Ashley, let's talk about those. How many of you have had an epidural steroid injection? Or maybe you haven't had an epidural steroid injection. Let's back up a second and let's talk about what they're for. See a pharmacist, East Coast. Oh my gosh. Yeah. So I do apologize for not supporting you on your lives. It's, man, the free time I'll try to, I promise. Let's see. Oh yeah, how many of you actually have low back pain or mid to low back pain or even upper back pain or neck pain? Any of those things. How many of you have back or neck pain? I'm thinking trauma. I'm open-minded though. I like trauma. My C7 is bulging. Oof. Yeah. Sciatica. Sciatica can be included in this talk for sure. All right. So I'm telling you what, this is probably one of the biggest, most common diagnoses that we see in the hospital is people with back pain, severe back pain, sciatica, neck pain, etc. Everyone's back is hurting. I got all the homework done. Nice. Congratulations. So, and there's a lot to do. And I'll briefly mention some of the basic things, which are critical in core. Do these things for your low back pain in your neck. If it's appropriate for you, again, general education, this doesn't apply to everyone. Not everyone should do these things. But you have low back pain. You're otherwise healthy. Someone comes to me, they're like, what do we do, doc? Well, you can always get some basic imaging, rule some things out, make sure nothing bad's going on. Nothing bad's going on. So we're going to start doing physical therapy, stretching, exercises, core strengthening exercises. That will help with the back pain. Right, can help with the sciatica and stuff too. I'm not as familiar with physical therapy for neck pain, but definitely work with a physical therapist. I'm sure there's exercises they can tell you to avoid and to do. Critical basic things. And then multimodal analgesia. That means walking up this pain ladder, starting with the easiest things first and going up. Should be things like Tylenol, ibuprofen, celecoxib, right? Going to stronger things. Topicals, lidocaine creams, lidocaine patches. I love it. Tiger Balm. Not a paid advertisement, but I love Tiger Balm. I was talking about it earlier in my life. TINS units. I love a TINS unit. Those are great. Pretty safe. And then other things. Those things haven't worked for you. The back pain's getting worse. Keep doing them. But let's talk about interventional pain, and that's where these epidural steroid injections, lumbar injections, trigger point injections, things like that come in to play, okay? Sassy, how are you? What's up, Sassy BBW Mama? So, epidural steroid injection. It takes 4 to 6 weeks to even kick in before it starts working. But they're injections you can get in an interventional pain clinic, okay? You can inject it in the epidural region of your back. We usually do a steroid, or there's several other medications that they could potentially try and inject, and it can reduce the inflammation and give your back time for everything to calm down and hurt less. Again, I'd say 4 to 6 weeks. Sometimes it can start kicking in as early as 2 to 3 weeks. Welcome everyone. Oh, I see Chelsea's on Facebook here, singing song. Hi. Where am I at? So do the epidural steroid injections. Those are great. You can also do trigger point injections, dry needling. Those things work too. If your epidural steroid injections and stuff, if they are working, okay, that's a good sign that a radiofrequency ablation might work. And if all these things scare you, if these needles are scaring you, I get steroid cortisone injections. It doesn't help for my bursitis. Oh, I'm sorry, Sassy. Radiofrequency ablation, though, might be something to try. Medial nerve blocks. Those are all good things. But if getting the needles and stuff really scare you, doing it under IV sedation with a little Versed or a little opioid to take the edge off, to make you not faint, pass out, and freak out, I highly recommend. Not everyone's insurance will cover that, but it might be really worth it. What's up, JC? I haven't seen you in forever. JC Rain. I have a TINS unit and it's great, but it only works a very short time. That's true, Becky. Oftentimes the TINS unit might stop working within minutes of taking it off. Miva brings up a good point. She's, or he, she, Miva. Miva says epidural steroid injections are not approved by the FDA. Most of the things we do in the hospital and the ways we use medications are not FDA approved, like using a beta blocker for anxiety, for example. But just because it's not FDA approved does not mean it's not in the guidelines and we don't have a massive amount of research backing its use, because we do. There is a whole lot of data and research to support the use of epidural steroid injections and the way we're doing it. Yeah, it's called off-label use. And we, oxygen or traditional anesthesia? I like both. But that doesn't mean it's not safe. What that means is that the company, let's say dexamethasone, whoever's making dexamethasone, it's been around for a long, long time. They're not going to pay to submit dexamethasone to be approved by the FDA for steroid injections, because there's probably not a lot of money in it. And of course, like research, like someone who doesn't own dexamethasone or doesn't produce dexamethasone, they're not going to pay to do that, right? And the reason why no one's paying to do it is because we're already doing that. We're already using it in that method. We're already using dexamethasone and other medications to do steroid injections. So like, we know it's safe. We know it's good. Does that make sense? I don't know. I do too, and I'm knocked out. Yeah, fact. Tay Swift fanatic, what's up? I too love me some Taylor Swift. I'm an OG though. They do use epidurals for C-sections. Epidural steroid injections and epidurals for labor are different. Mushrooms aren't FDA approved either, but Elon Musk doesn't care. All right, not my words. I'm repeating comments just so everyone knows, because I'm live on all the other platforms as well right now. Most of the comments are coming in on TikTok though. My back has been jacked up for years. I have all of the above. It's so lovely and feels great. Oh, good. Good. So those things are working. What was the option you mentioned for my bursitis pain? You said it way too fast. Maybe I should be an auctioneer. Radio frequency ablation, potentially. But follow back up with your interventional pain doctor and ask them like, hey, we tried this. It's not working. What else can we do? I finished all my schoolwork. Are you in college, Tay Swifty? You should go to school to be a doctor. Pain pumps, implantable spinal cord stimulators. Ooh, Hides, what are you not getting approved? I missed that. You're welcome, Sassy. You're very welcome. Spinal cord stimulator. Yeah, spinal cord stimulators can be life-changing. Another thing that can help that is pretty new that I don't think is talked about enough is what's called a peripheral nerve stimulator. It's a Sprint. It's called Sprint, SPRINT. I don't know what it stands for. It's a Sprint device. Let me see. It's just the name of it. Sprint peripheral nerve stimulator. It's a short term. It stays in for 60 days. And that's that. All right, guys. 2 fun things that I'm going to do tonight. Because twilight sedation is the best. Can nerve supplements help if I take them for nerve pain and tingling on my feet? What are nerve supplements? What's up, Mariah? What's up? Mira? Oh God. I never say your name right. I'm gonna quit now. Yeah. Okay, don't get confused with what I'm saying. PNS, like the letters. Papal, November, Sierra. Trigeminal neuralgia. That's a tough one. There are some medications like carbamazepine, etc., that might help, even gabapentin, but sometimes a surgery is needed. Neurosurgeon does those. Kyle, go over the Krebs cycle. 2, go over glycogen diseases. Kyle, number 1, no. Number 2, I brain dumped those many years ago. I know enough to recognize them, and when I have a patient with them, I'm like, oh my God, we got to look this up, make sure we're doing the right thing. But that's why I'm not in Pete's. Always come in with the tough questions, man. What's up, Milo? Thank you for the chilies. I know, man. I know. Me too. Wendy, how are you? 90%, 95% of holistic is a red flag. I would agree, right? I like holistic medicine in the evidence-based sense. Just be mindful when it comes to holistic providers about their financial conflict of interest. If they're saying, hey, we'll detox you, we'll do this stuff, book an appointment with me, man. We'll do a full body assessment. We'll check out your gut biome health, and we'll make sure you're pooping like you've never pooped before. Red flag. All right, let's get Jennifer on here, and we're going to talk about amniotic fluid embolisms. We're going to share her story, and we're going to all learn and hopefully be better for it. I believe that Jennifer's, she's starting, I feel like you started your TikTok journey pretty early, huh? We'll see. I invited you on, and you can let us know. And then after that, I'm going to do a segment where we invite random people on and quiz them if it's a pharmacy medical term or Pokemon. What's up, Jennifer?
Can you see me? I've never done this before, so this is very interesting. I'm like a little square in the corner down here.
I'll give you the big screen to introduce yourself.
Okay, perfect. Hi there, I'm Jennifer. I experienced an amniotic fluid embolism in February of this year, and I never knew what it was or anything about it until I experienced it. I went to the hospital at 37 weeks pregnant with excruciating headaches and spiking high blood pressure here and there, and ended up getting induced. And so I just am trying to kind of like spread awareness on amniotic fluid embolism, because clearly it's not something that's talked about enough. So I actually joined Dr. Zach's live, what was it, last night or the night before that? And,
something like that.
Just trying to like almost talk to any sort of like medical provider that there is, no matter if you're like involved in any sort of, like labor delivery or anything like that. Because like you're saying, like your experience varies, like although what you're doing right now might not be what you did, 5 years ago or something like that. So, if you are working in labor and delivery, it's clearly your biggest fear, but otherwise, like, people don't talk about it. So I am trying to raise awareness, but also at the same time, I feel like it's a huge like coping mechanism for me to just talk about it, because everyone's first suggestion for me is to go to therapy, and I don't know that I could talk to a therapist about something that they've never been through. they're going to probably give advice that I've already heard that I feel like almost just kind of like frustrates me in a sense. So like, be grateful you're alive. And it's like, I am grateful I'm alive, but at the same time, I'm like really upset and angry at the way my baby and my one and only was brought to the world. So
Yeah.
I just want to talk about it and, you know.
Well, there is evidence to suggest that talk therapy does help very much. But talk therapy doesn't have to be necessarily with a therapist. But what it does have to be is exactly what you just said, talking about it.
Yeah. Talking about it also with people that kind of understand like the severity of it, because I think a lot of people, like I was telling you, like with my work and things like that, unless you actually understand like what ECMO is and things like that, they are just kind of like, oh, okay, she's home from the hospital and she's like alive, so she's perfectly fine.
Nope.
And someone mentally and physically, you know, the next person that would have went through something like that probably wouldn't be ready to return to work, but I was like willing to. So that's been something also that I'm trying to like understand and I guess cope with, is that maybe it was kind of like a blessing in disguise that I wasn't able to return working there. But it gives me some sort of, I don't want to say like I need validation, but like we have a lot of friends that are nurses. I have 4 friends that work for Hopkins, and then just all of clearly like the nurses and doctors that I've been interacting with on here that have gave me some form of validation in saying that like I don't need to be told that like I'm a miracle and like all those kinds of things. Like if anything, when I was told that when everything first happened, I was like, I just want to be a mom. I don't care that I'm a miracle. I don't care that I'm a hero. I don't care that I'm all these things. I just want to be a mom. But now I'm like past that point and I'm like, okay, I'm a mom, but also coming to the realization that like this is so rare. This doesn't just happen, you know, this isn't like a heart attack, not to discredit people having heart attacks, but like it's not something that's talked about. Like my family was like, she had a what? Like what is this? And no one's ever heard of it, or you know. So getting validation on not only like what happened and that it's okay that I like feel the way that I feel still. It's literally been 3, almost 4 months, and just the severity of everything is extremely helpful, because in the beginning, like I was almost in like just disbelief. I would have doctors come in and they're like, you died. And I would just look at them and I was like, nah, like, what are you talking about? You're joking. Like I passed out or something, you know, it just didn't feel that way. And then once I started to like, you know, actually realize what happened was when I kind of started to understand, but still like to this day, when I think about it, I'm like, did that really happen to me? Especially because like it hurts so bad to be on these support groups and see that these women that have been through this have like just long lasting, you know, like not being able to talk, not being able to walk, like, you know, those kinds of things. I think that the worst thing that I'm experiencing right now is memory loss. Like I can't remember people's names, vocabulary recall. I couldn't think of the word risk the other day, and I looked like I was going crazy. And my poor fiance, I look at him and I'm like, I'm really sorry, I don't remember, or I don't know, or you have to tell me again. Like just at 27, like my memory was so sharp, and now I just like can't even remember people's names. And I worked in healthcare, so like part of me is like, maybe it's probably better that I don't work with patients or clients right now, because I once I was talking about going back to work, I went to my work and was like seeing clients that were clients, like I could see their faces and I was like, I know that I know this person. I do not know their name. I literally could not. And my memory was like, I would call people by their name. So it was just very upsetting. But I'm like so grateful. It's like not only for myself, but for her. Like she has nothing wrong with her. She wasn't even on oxygen. She was 8 pounds, 4 ounces, and just is the literal most easy baby ever. She's an angel.
Well, let me take a moment to tell everyone in the chat a little bit more about what an AFE is, and then I'll ask you a few questions if that's okay.
Yeah, go ahead. No, you're good.
So amniotic fluid embolism, don't confuse it. A lot of people do with a pulmonary embolism. It's not an actual clot or an actual, it's a terrible name because it's not an actual embolism that goes into the body. You probably had no, did you have any issues during pregnancy?
I had the pup rash.
Mm-hmm.
I don't even know what the letters stand for, but
It's
it was
very common.
okay. So
Yeah.
that's all. And then the last 3 weeks of my pregnancy, I never experienced high blood pressure at my appointments. It was only like when I was home, it would randomly be high. And when I say high, like 140/90, but for me, I'm normally around like 115/70. So it was high for me.
So much like most people who experience an AFE, is a relatively normal pregnancy, it seemed, and it usually is something that occurs during the active labor process, oftentimes during C-sections. Some substance from the baby enters the mother's bloodstream, and it could be a very small amount of the substance. And essentially, the mother's body sees that material, that maybe it's amniotic fluid, maybe it's something else, and it mounts a massive immune response, kind of like septic shock. Maybe you guys have heard of sepsis. And the response that the mother's body has to that foreign substance in her blood is inappropriate, much like when my wife gets mad at me because I don't take the garbage out. Her response is very inappropriate. Just kidding, guys. Just kidding. Please don't be mad at me. So then that leads to things like heart stopping. Did your heart stop?
Yeah, my heart stopped, and it only took them 1 round of CPR to get me back, but I was without oxygen for over 2 minutes.
Wow.
My heart stopped actually with my fiance, like in the room, and I was like, got past the epidural, got my water. They didn't break my water, but when they did the cervical check, my water broke. And I, shortly after telling the anesthesiologist, I feel like my epidural wasn't working. It was only like from my left thigh down to my toes. That was numb. Everything else I could feel. She was like, okay, like we can replace your epidural. Like, is that something that you would want to do? And I was like, kind of just, already in pain. So I was like annoyed at having to have it replaced. So I was like, let me think about it. Let me see if I feel like I can kind of like push through it. She left the room to give an epidural to another mom. And I was on my left side with the peanut ball between my legs. And I just looked at my nurse and I said, my head and my chest hurt so bad. And the best way I can explain it without because I didn't say this, but is that I felt like my brain was going to come out of my ears. Like my brain just felt like it was like there was so much pressure and it was just going to explode. My nurse actually ran out of the room to get help. And when they came back in was when they coded me, and my fiance was in the room. He was, I don't remember, but he was on my right side when she was on my left. I don't remember that at all. I asked him, I was like, were you in the room? He's like, yeah, I was right there. You're right. You kept saying you were in pain. We couldn't figure out why.
So why people oftentimes don't remember when they arrest is because when blood stops flowing, oxygen's not going to your brain. It's kind of like getting choked out, right? You kind of pass out. And so you can't form memories anymore because there's not enough oxygen going to the brain. And, we said run a code and we said cardiac arrest, but what these things mean when the heart stops, usually you have to start CPR. So you push on the chest and you have to give a drug called epinephrine. You're giving epinephrine, which helps chemically restart the heart and get it to squeeze again. And then you're doing other things for if you're suspecting an amniotic fluid embolism, oxygen, atropine, and some other things as well. They have that saying A-OK. But the thing is, there's no good evidence to support any treatment for AFE.
Yeah, I don't think that they realized that it was an AFE for a period of time because, of course, they had to go through rolling every possible other thing out.
Yeah.
So they based it all of the doctors. And I didn't think about it this way. I was just like, oh my gosh, they knew exactly what to do. I was having an AFE, and they were like, we weren't treating an AFE, we're treating your symptoms. Like, you were in cardiac arrest, and you were without oxygen, so on and so forth. So they were just treating my symptoms. And they got me back with the 1 round of CPR, and I don't remember vividly saying this, but when I read it in my chart, it's like when people say things to me, I'm like, that kind of rings a bell, but I can't pull it out of my own brain. It's the weirdest thing. Actually, the anesthesiologist herself, when I met her, I was like, I couldn't tell you what this woman looked like, sounded like, nothing. And then she came in the room and
shoot.
It says that he paused.
Yeah, no, hang on. I have to check something real quick. Sorry, my phone went into do not disturb, and I'm on call. So at any point in time, I could get called into the hospital. So I had to make sure.
You're totally fine. But yeah, the anesthesiologist, she came in the room to, like, I say meet me, but, you know, it's because I, again, don't remember a lot of these people. But as soon as she came in the room, I was like, oh, okay, like, now I know I'm real. When they got me back with the CPR, before fully sedating me, I was asking for the baby, and I was like trying to figure out like if she was okay. I became like really agitated and trying to pull at everything, and I vividly like remember being just anxious, knowing if something was happening to me, I knew it was going to affect her.
Mhm.
But after that, I was lights out, and I'm like so grateful because everyone's like, oh, do you remember this? Do you remember that? And I'm like, I don't remember any of it. I don't want to remember any of it at all. Like, I think I remember too much, enough, you know,
Yeah.
that I have to live with kind of thing. But I wasn't aware of any of it. So.
I think one of the symptoms or issues with the AFV that I think is undertreated is what's called a coagulopathy, where all the things in your blood go whack. You bleed too much, you don't clot enough, sometimes you clot too much, sometimes all those things happen all at the same time, and it makes no sense because they're everywhere. So giving patients things like, again, it's probably really too much, but like fibrinogen and cryoprecipitate, all these things can be really helpful. I'm sure you probably got some of those things, maybe.
Probably. I think my bill of pharmacy needs was like $9,000, and again, it's like so silly because it's like Tylenol 70 cents, fentanyl $50, like whatever throughout it.
Yeah.
It all counted.
Watch the F words and
okay.
words that maybe are associated. Like there are certain words that TikTok will flag us for.
Okay. But yeah, just any of the medications I have a hard time with. I think the only ones that I'm familiar with are the ones that cause the I might be saying it wrong, but I think it's like extravasation or something like that. I had that happen with my IO and my leg.
Oh, extravasation, yeah, bleeding.
Yeah.
And so. Oh, sorry. Go ahead.
No, you're fine. It was like almost necrotic. It was
wow.
Really, yeah.
And you also, so sometimes, and this happens quite frequently when you have CPR, your heart, even though you come back, your heart and your lungs don't work really well, and you had to go on to ECMO, right?
Yeah, so it was on the VA ECMO, so for both.
So
I think I was only actually on that for 17 hours, which is apparently like extremely impressive. You're typically on it for a lot longer, so I really didn't need to be on it for that long. But my mom said that the one nurse said once they got me back that like my heart and my lungs were they were there, but they weren't doing what the doctors wanted them to do. They were very weak, and my heart was just beating really slow. And I remember her saying that my blood pressure was like 77/40 or something like that, and was on ECMO for 17 hours. With all of that, had to have my blood replaced 4 times, like fully replenished 4 times. My fiance said that they were bringing like coolers that you see at a baseball game and blood.
Yeah. So you got those things I mentioned earlier. Those were in the cooler. So the ECMO being on 17 hours, yeah, that is quite impressively short. But and maybe you didn't need to be on ECMO. I don't know. Hindsight's always 2020. However, I know that if you are supposed to be on ECMO and you're not, you won't survive. But the other way is not true, right? If you're on ECMO and maybe you could have made it without it, if it were me, I would rather have gotten ECMO and not needed it than needed ECMO and not gotten it.
Yeah.
Sounds like the right call.
There's apparently like a time frame of like when you should be taken off of it as well. You shouldn't be on it for like too long or something like that. They said to my mom, and like we're having her sign all the papers and everything. Being that my fiance and I aren't married,
yeah,
she had to be signing off on all of that.
Yeah, absolutely.
Kind of stuff. So I don't ever remember having the ECMO or anything like that because it was removed before I even woke up. I just woke up with the stitches in my groin. And of course, again, you wake up and you're like, why the heck does my entire body hurt? I was imagining C-section, like, that area hurting, but it was like, felt like I was hit by a car. So
What would you tell to women who are pregnant and have heard your story and other stories and they're scared? Now they're scared. Oh, what if I get an AFE?
It's like very hard to say. I feel like I don't know the right thing to say. I don't know that there's anything like wrong to say. I know that one of the biggest things that I probably would have done differently, or at least not done at all, is like I'm all for women wanting to have like their own birth plan and just like I have a friend of mine right now that wants to do like a home birth and things like that. Not knowing that what this is, sure, it's like a beautiful idea of doing something like that. I just don't know that it's worth it after experiencing something like this myself. But also just being prepared in like the hospital that you're in. Like if I hadn't known that this was like a thing, like say, just not realistically speaking, but like it's something that could be passed down to, through my mom or something like that. Like, and I knew like, okay, there's a chance that I could have an AFE. In my brain, I would have been like, okay, I need to be at the hospital that has like ECMO, so on and so forth. I wasn't. I had to be transferred. And there was this critical moment where they were like, do we take her by an ambulance? Do we take her on a helicopter? It's a 4-minute difference. You're like, 4-minute difference. Why the heck does that matter? Clearly, because it was going to make a huge difference on whether or not I was going to make it. And they were hesitant about the helicopter because they knew that one would have to wait for the other before the next could come in. So I went by ambulance. But, not that it's going to be passed down from like the mother or anything like that, but talking about it and like knowing that there's like ECMO and like just the different things that you have to be like put on to save your life. And those, like, I haven't spoken to a woman that has experienced an AFE that hasn't been on ECMO. I mean, I'm sure it's out there, but I would just like to be in a hospital prepared with that. And it is scary, and I don't want to act like it's not scary. I'm not going to tell, I think that the biggest thing with the like OBGYNs right now is that women are saying like, oh, that won't happen to you. It's so rare. Oh, that wouldn't happen to you. It's so rare. I would not want to be told that. I was told that I wasn't going to have preeclampsia because my mom didn't have preeclampsia. I ended up getting induced with preeclampsia. So just advocating for yourself is like the biggest thing. If you're scared and you want to be in a hospital that has, X, Y, and Z that this other hospital doesn't have, or you don't feel comfortable with like just anything in the situation, advocate for yourself. I didn't have a birth plan. I just was like, I'm going to push this baby out and it's going to be beautiful. And nothing that I wanted to go my way went my way. I had all the say in the world, and within seconds had no say as to what was going on. It's hard. It's hard to even give like advice on it, especially like with this being so fresh for me. I want people to be able to openly express like their fears and talk about it and things like that. But I actually, just to give some sort of, I guess, piggyback on like how I'm feeling about it and how I feel like I can't fully put together like a good piece of advice, is that my OB reached out to a perinatalogist. Is that how you say it? Like a high-risk pregnancy doctor? Oh,
yeah. Usually it's MFM, maternal fetal medicine. Is the high-risk pregnancy.
Perinatalology, something. I don't know. Whoever she reached out to about like me having children in the future.
So perinatology is a synonym for maternal fetal medicine. So we're talking about the same thing. Perinatology or MFM, maternal fetal medicine.
My OB reached out to them and they denied the consult because they said that there was no recommendation that they could give at the moment about it, and which was very disheartening. But at the same time, like, it's a reason why I want to try to like raise awareness and like talk about it, because there are women that are like scared that it's going to happen to them and things like that. I will say that the one thing that a lot of these women are saying that matches up with how I felt and what I was saying was headaches prior to going to the hospital and being admitted, which is like so hard because that's such like a common
It's
thing
so
that
common.
experience.
Most women come in with a headache, and so if we treated everyone with a headache like they were going to have an AFE,
Right.
we'd be treating everyone with it,
So headaches, but then while it's actually happening, I wasn't in like pain. I just felt like something wasn't right with my body. And this wasn't contractions. This wasn't, like feeling like I had to use the bathroom, like the catheter. It wasn't anything like that. This was fully like in this area, felt like there was no pain. Like it wasn't, I would say more pressure and like tension. My nurse actually said that the look on my face was like impending doom, that I just gave her this look of like, please help me right now kind of feeling. But again, like that can happen in other case scenarios and things be not the same. So it's hard. I've had a lot of women that have like commented and reached out and like, ask questions, and I'm not a doctor, I'm not a nurse, so I don't want to give any sort of advice on something that like I could be completely wrong with. But just in pregnancy in general, advocate for yourself, please, and don't make a decision based off of like a want. When I speak of like home births and things like that, like I would love to. I think any woman would love to experience a home birth, unmedicated, like all these beautiful things. It's not worth it.
Karen said, maybe she put it well. I'm a retired LDRN. I'm all for women delivering as natural as they'd like, but don't be inflexible.
Yes.
So I guess two things is one, I'm going to ask. I do anesthesiology. Any advice for me or anything your anesthesiologist could have done differently?
No, she was actually. I don't want to say she's like a typical anesthesiologist. She was very like, we're either going to do this or we're not, and it's not going to feel good. It's going to hurt, but you need to stay still. And she was very straightforward with me about getting the epidural. And then when I told her that it felt like it wasn't working, I don't know if when you get an epidural, you're supposed to be able to like move your legs. I couldn't move my left one, but I could move my right one.
So it wasn't working right, which is I tell women when I do an epidural, about 1 in 5 to 1 in 8 won't work. And it's not because anything's wrong with them. It's not because anything's wrong with me and I didn't do it right. It's just because that happens. So you're not supposed to really be able to move your leg.
Yeah, no, she did an amazing job. And like, even when I saw her recently and everything, she said that she was confident that like I was going to do well with it, because my family was in the room, and when she had to ask them to leave, I said, don't say goodbye or I love you or anything like that. It's going to just make me upset. I just want you to walk out and you can come back in when I'm done, because I knew I would get like emotional. And she like gave me kudos on that, because she was like, yeah, a lot of women, like if they have their fiance in the room, they'll like, bye, I love you, whatever. And they get themselves like so worked up about it. And I just sat on the edge of the bed and I was like, please just do it and get it over with. And she was like she talked me through the whole thing. She did a lot of like what my OB does, where she's like, okay, you're going to feel me do this, you're going to feel me do that, like touching on my back and things like that. I guess I would say a piece of advice, and I don't know if this is a piece of advice or if this is something that you can actually kind of like comment on. I freaked out because I thought that I messed it up, or I thought that something was going to happen because I flinched.
Yeah.
Of course, they tell you like, stay still. You have to stay still. Don't move. You have to stay really still. It's gonna hurt, but you have to stay still. And I flinched, and I panicked, and I was like,
sorry, my phone's gonna die. I'm trying to get it on the charger.
Okay. I was immediately thinking that I was going to be like paralyzed because I moved while she was doing my epidural. Terrifying.
It's pretty, especially if it was a minor flinch, pretty rare that anything serious would happen. The most common thing would be like a spinal headache. You get a spinal headache from it, not from the flinch. But there's no way to prevent it. Women do that all the time. So you just gotta, as the anesthesiologist, you have to be paying attention if they're moving. And when they're moving, you kind of make sure that the needle's either not in, or that you don't keep. The problem is if you shove actually, I think I have a needle right here. So if the needle is in the back and then the patient flinches. So if my hand's here pushing the needle forward and then you flinch backward and I'm pushing forward, it can go too far. So that's why when I know you're moving, I just kind of let my hand off, and then when you flinch, it just stays where it is and moves as a whole. But any last words you'll say you want to share with the group?
Well, I just appreciate it, and like talking about it is like extremely helpful. Like I said, you know, there's somebody commenting right now. If you have an AFE, are the chances of having another higher in future pregnancy? It's a good question.
I don't know. I'll have to look that up.
I don't know, and I've been told that it just is rare and it just happens or it doesn't. So it's probably why I won't be having any other children. But no, I'm just grateful that I'm here, and I just hope that talking about it and spreading awareness, and you know, it sucks that it's happening, but I feel like it's getting more awareness with people talking about it and things like that. And although there's like tons of women that are scared of it, it has clearly been talked about it enough that it's reaching a lot of women and a lot of medical providers. And the AFE Foundation actually, I don't know exactly like how it works. I'm sure if you just went onto like their Facebook or Instagram and message them, they'd be able to like fully explain it. But they offer like classes and simulations, things like that, where they can come out and like help and give different like readings and trainings and all the things. But they also have like a hotline. So if you're in a moment where a woman is in labor and she starts to not feel well, and either before, during, or after, like you said, you can call them and they will like walk you through it. You know, I don't want to say that there's hospitals. I hope that there's hospitals out there that, or there's not hospitals out there that just like wouldn't know what to do. But I'm sure that it's like a scary moment for everyone. My OB herself has been an OB for 22 years and had never experienced one. So
Yeah.
although you do a simulation, you don't actually full hands-on experience it. So the AFE Foundation, although they are very small, they are very strong, and they have a lot of like just advice and you know, like trainings, things like that. I talk to them all the time, like directly. So you know, even if you had like questions and things like that, I'm sure that they would be able to give more like information or guidance on just things like that. So
yeah, thank you so much, Jennifer. Thanks for sharing your story. If you guys don't follow Jennifer, click on her. I think you can just click on the name up there and follow her. So thanks so much. Have a good night.
You too.
How do I do this? Okay. Oh my goodness. I'm such a boomer. To answer the question about the AFE, does it predict another one? So rare diseases are hard to study because they're rare. There's not a lot of data, but from some of the data that exist, it doesn't look like having one amniotic fluid embolism puts you at a higher risk of having a future one. But the data is very limited. Jennifer did state a chance some health problems. It seemed like a lot of them stemmed from the ECMO. If you're still on, feel free to chat if you'd like to. Ashley asked about kind of what symptoms you're still having. So, man, I was thinking about going to a different segment, but it's hard to go from that segment to anything else. That's a hard act to follow, right? Yeah, you guys should all go follow Jennifer. Help her spread awareness. So I reversed my diabetes, lowered my blood pressure, and all my work. Oh, that's awesome. Congratulations, Fastlane. Back to crazy ER doctors. Yeah, she spoke on, yeah. Holy cow, a lot of people in here. Oh, do we? It's pretty good. Pretty busy night, huh? Okay, let's see. I was thinking, if you guys are into it, inviting different guests on and quizzing them on, is it a Pokemon or is it a medical term? Do you get to do anesthesia on kids? Yes, I do. 2 plant food products. I don't know what you're saying. Oh, nice, Jennifer. All right. Let's see how this goes. It's a more lighthearted thing, much less serious than Jennifer's talk. But thank you so much, Jennifer, for coming on. What is the best diet thing to do for endometriosis? I'm on an 8-month wait list for surgery at the moment. Goodness, Abby. Oh, I don't know of any diet modifications that help with endometriosis. If anyone has any experience out there, let me know. Let me know. Should I invite random people that aren't on the chat, or should I invite people from the chat for this? Mindy says no diet helps. Have you done anesthesia on infants? I have done anesthesia on infants. Okay, we'll go back and forth. I'll invite a couple people from the chat, and then I'll invite some rando host from chat. You'll get super weirdos from the outside. All right, let's see. Hang on. Oh, I think I just invited someone on accident. I don't know. Let's see. Mindy said she wanted to come first. Let's see. All right, Mindy, I'll ask you one question. If you get it right, the whole crowd will applaud you.
Okay.
All right. Metatarsalgia. Is it a Pokemon or a medical term?
Not a Pokemon.
You know them all, don't you?
I play on my husband's Pokemon Go because we can reach like stops and stuff from our house. So he logged in on my phone and I play for him.
Okay. I'll ask you one more then. Chandelure, Pokemon or medical term?
I don't think that one's a Pokemon either.
That was a Pokemon. Maybe I missaid it wrong. Chandelure.
My son will be disappointed in me.
Let's see. I have no idea. Oh, it looks like a chandelier. That's what that one looks like.
Yeah, that's right.
All right. Thanks so much, Mindy. Have a good night.
Yes.
Boop, 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 boop. Let's see. It looks like, okay. I'm just going to start accepting the guest invites. Did it work? I clicked accept. Is it working? Huh. It's not working. I don't know why it's not working. Let's see. Queen. I don't know. Who else wants to come on? There is a doggy. I'm in a hotel. They live next door. That is a sign, Zach. This is so much better than getting pimped in the hospital. Yes, that's true. I don't know why I'm accepting these guest invites and they're not, it's not working, guys. Huh. Here, I'm just going to blast out a few invites and we'll see what happens. And if multiple of you are on here, maybe we'll just mute until we get to the next one.
I knew you were going to pick me.
Hi, VJ. Are you ready?
Yeah, I guess so.
Erythema. Pokemon or medical term?
I don't know. Pokemon.
Pokemon. No, erythema. It means red skin.
What does it mean?
Like red skin.
Oh, red skin.
Red skin. You know, kind of like a rash.
Right?
Yeah. What?
Nothing.
You want another one?
Yeah, shoot.
Thundurus.
Say that again.
Thundurus.
Oh no, that's Pokemon.
That is a Pokemon. Correct.
Oh, you're getting me an easy one.
That was. I don't know any of these. All right. Let's see. Thanks so much, BJ.
See you.
Have a good night. Let's see who's next. All right. I'm just going to keep sending out these invites. Richards. We'll get someone on here.
Hello?
Hey, Wendy.
Hey.
You ready?
I'm ready.
All right. Dextromethorphan.
Medical?
That is a medical term. Good job. Okay. Garchomp.
What'd you say?
Garchomp. Are you asking someone else, Wendy?
I have no idea. No, I'm not. I hear you. I said Pokemon?
Oh, yeah.
Pokemon.
Good job. It's a Pokemon. It's a Pokemon.
No, my AirPod is falling out of my ear.
Oh, don't you hate when that happens?
Okay, well, that was fun.
Hey, you're welcome. Thanks for coming on. Let's see.
Thanks.
Have a good night.
You too. Bye.
Do we have someone else ringing in? Emmy?
Hey.
Did I say that right?
Yeah.
How are you?
I'm good.
Where are you calling in from tonight?
Wisconsin.
Wisconsin. What part?
Central.
Love it. So beautiful up there, actually.
It is very beautiful here.
Someone at your house?
My dog.
All right. Let's see. Klefki. Medical term or Pokemon, Emmy?
Say it again?
Klefki. Klefki. What'd you say?
Pokemon.
Pokemon. That is correct. Klefki is a Pokemon. All right. Here's another one. Carkle. Pokemon or medical term? Carkle.
Are you saying Carkle?
Carkle. Carkol.
Pokemon.
Correct. 2 for 2. And
Right.
I got a medical question. I've seen it. I think I saw it before. Is it normal to hear things before a seizure? Yes, it's very possible that you could have phantom hearing things. Emmy, you enjoy Wisconsin for us, okay?
Sounds good.
Good night. Okay, who wants to go next? Nancy?
I will.
Who said I will?
Nancy Karma,
Hi, Nancy. Where are you calling in from?
Portland, Oregon.
Portland, out on the West Coast with me.
Yes.
Love it. All right. Let's see. I got a good one right here. How about xerostomia?
Medical term.
Correct. And then we will do Baxicaliber.
Ooh.
Baxicaliber. Are you cheating, Nancy? That's a Pokemon. Good job.
Thanks.
That thing's a big one too. It looks like a dinosaur.
Cool.
Who is your helper tonight?
My husband.
Oh, I love it. All right. You guys have a good night and enjoy. You said Oregon?
Yeah.
Yeah, I've never been up there.
Oh, you should visit sometime. It's beautiful.
I'd love to. I'll wait for the invite, okay?
Okay.
Have a good night, Nancy.
Thanks. You too.
Susan, how are you?
Hey.
All right. You want an easy one or a hard one?
I really don't know Pokemon, so I don't know.
All right. Let's see. Brady Kynan.
That's medical.
Correct. Bonus points if you know what it is.
Pretty certain it is an enzyme.
Yes. It increases your blood pressure. Very good. All right. Let's see. Acanthosis.
That sounds.
Pokemon or medical?
I want to say it sounds medical.
Correct. Acanthosis. That I'm pretty sure is the medical word for like toe infection. Let me just double check this. Acanthosis is in the context of skin, thickening of the skin, specifically the epidermis, due to the number of stratum spinosum. Acanthosis. I'm not a dermatologist. Don't ever quote me. Thank you so much, Susan. Where are you from?
I live in Illinois.
Ooh, I went to med school out there. What part of Illinois?
Chicagoland.
Chicago. I love it. If you're not from Illinois, you pretty much only know Chicago and then everything else. So, but have a good night, Susan. Thanks so much.
Okay, can you boot me?
Yeah. All right. Chicago. Let's see. I don't know why TikTok is being so weird. Here, I'm going to cancel everyone's guest request if you're requesting. And then maybe you could redo them. I don't know. Let's see. Let's see if we can get just a random host on here. And then maybe we'll come back to the guest because it's being weird. What's up, man?
Hey, Greg, I appreciate you, baby. Hey, Greg, thank you for all the love, man. Appreciate you.
Hey, I got a question for you. We're playing a game. It's called Pokemon or medical term. I'm going to give you a few words and you tell me if it's a Pokemon or a medical term, okay?
Okay, let's do it.
You ready? All right. Myasthenia. Pokemon or medical term?
That sounds medical.
Correct. First one. All right. Zoroc. Pokemon or medical term?
Shit, you said Ciroc. You get that at the ABC store.
That's a Pokemon. Zoroc.
Oh, I thought you said Ciroc.
Z.
Man, fuck. I didn't know shit.
All right.
Fuck it. I fucked up. Okay.
You're good. All right.
Wow.
Colon.
Wow. Hey, let's go.
Cholangitis.
Let's go.
Cholangitis. Medical term or Pokemon?
You said what?
Cholangitis.
A vagina.
Cholangitis.
For entertainment purposes only, cholangitis. That sounds like something like a colonoscopy. So I'm going to say doctor.
Good job. You got it. All right. Klefki.
What key?
Klefki.
What the fuck did you just say?
Klefki.
What the hell? Okay, from Zach. Hey, what's good, my guy? Thank y'all for the love. Thank y'all. Appreciate y'all. All y'all coming in talking so you funny as hell. Appreciate it. Hey, Dr. Zach. Hey, I like the vibes though. That's dope. You like, hey, I got questions for you. You a doctor. That's dope. What you doing?
Oh,
Let's go.
I just listen. You can show me anything you want. You can ask me any questions. But if you wouldn't post it on Facebook, I don't want to see it.
All right.
Drampa. Pokemon or medical term?
A tripod.
Drampa.
Grandpa?
Drampa. D-R-A-M-P-A.
Grandpa. That's definitely a Pokemon.
Man, you're good.
Grandpa.
You're good. All right.
See, that's how I'm going to get these answers right. I know how to do it. Come on. That's how I'm going to get these answers right. Let's go. Hey, keep action. Watch this.
All right.
I figured it out.
Xerostomia.
Xerostomia. That sounds like a Pokemon.
It's a medical term.
I knew it.
You're pretty good, though.
It sound right when I said it, Pokemon.
Achalasia.
Oh, that's definitely medical. That's definitely medical.
Yeah, you got it.
That sounds like some shit to do with the nails.
Baxcalibur.
Baxcalibur. Oh, that's a Pokemon.
Yep.
Baxcalibur. Yeah, I can see that. Yeah, Baxcalibur. Yeah, I can see that.
Meridian.
Meridian. That's medical.
That's a Pokemon.
Fuck.
All right. Here's a good one. Audino.
Pokemon.
Yep, you got it.
That was
Yeah.
Yeah.
You're ready to be a doctor, man.
Huh?
You're ready to be a doctor.
Hey, let's go. I knew I was smarter than a fucking bullshit doctor.
Doctors are dumb, man. I wouldn't trust them.
He said I wouldn't trust him.
I wouldn't trust them. Erythema.
Narathema?
Erythema.
Erythema. Pokemon.
No, sorry. That's a rash.
Oh, fuck you. That's a rash.
All right, here's a good one. Rivaroxaban.
Huh?
Rivaroxaban.
River Roxaran. Pokemon.
No, that's a medicine, man. That's a blood thinner.
What the fuck?
Thins your blood.
Are you serious?
Dead serious. 100%.
Oh my God.
All right.
Okay.
Thundoris.
I got one for you.
Yeah. You go.
Amoxicillin.
That's a Pokemon.
He's like,
Pokemon.
that's a
Pokemon. Everyone comes in asking for that one. It's a Pokemon. Ibuprofen, that's what they give the people in the army when they're hurt. All right.
What's up, man?
Chandelure.
Huh?
Chandelure.
Pokemon.
Yep, you're right. Apparently, it looks like a chandelier.
Is it?
Yeah, where are you from?
I'm from New Orleans, man, but I live in North Carolina.
Nice, New Orleans. I was stationed down in Fort Polk. You know where that is?
No, I've never heard of it.
It's you know where Alexandria is?
Yep.
It's an hour west of Alex,
Okay. That's
Middle-
what's up, man.
middle of nowhere. You like some boudin?
Huh?
Boudin?
Yeah, oh hell yeah, Buddha and all. Hey, I came down here in North Carolina, asked him what the. I said, you know, I was fresh from New Orleans. I was like, hey man, y'all got Buddha. I went to Walmart. They was looking at me crazy as hell. I was like, you know, the little shit with the rice and sauce. They were like, huh? Like fucking Buddha, bro.
All right, man. You have a good one.
Hey, you too, man. Nice to meet you. Thank you a lot, bro. That was dope.
Yeah. Take care.
Hey, follow my content.
I did.
Thank you, brother.
Bye. That guy was fun, huh? All right, let's see. Here we go. Now they're working. It seems like they're working. We're back. Hippie gal, what's up?
Hey, hi, Dr. Zach. How are you?
I'm well. Yourself?
I am doing great. Illinois here. Hello.
What's up? Illinois, where at?
So I'm Northern Illinois, right by the Rockford area.
Nice. Rockford. Are you ready? You want some easy ones or hard ones?
I am ready, and I will leave that up to you.
Telegin.
You go ahead.
Oh my gosh, I can't even say this one. Telangiectasia.
Hey, if you can't say it, you can't say it to me. That's it.
But you can hear it, right? Telangiectasia.
Yeah, I can. Telangiectasia. Okay.
Yeah,
that's
close
a
enough.
medical term.
Yep, that's a fact. All right. Craniopharyngioma.
That's a medical term.
Yeah, you're good. You don't want a craniopharyngioma.
No, I don't think so. Anything Korean right now doesn't sound too good.
I agree. Have a good night.
All right, thank you. Thanks for having me on.
Let's see. Ashley, I don't know why this is messing up. Are you on, Ashley? I'm accepting your thing. Oh, goodness. I don't know what's happening. Let me do, well, I'll switch back and forth because that seems to fix it. When I do the host and then come back, and then, because it's not letting me do guests right now. I don't know why. What's up, guys?
What's up, dude?
What's up?
All right, we're playing a game. If you're up for it, you know, we can do it, but I'm asking if it's a medical term or a Pokemon.
Okay, I'm down.
Are you guys doctors or nurses?
Nope. No.
Okay, perfect. Either way, it'd still be good. All right. Tinkaton.
Pokemon.
Correct. Neuroblastoma.
Medical.
Do you agree?
Yes.
You're right. You trust. That was good. That was good. Trichotillomania.
Medical.
Are you sure?
Yes.
Okay, that's correct. That one's an interesting one. That's where you pull your hair out.
Oh wow.
Yeah. All right.
Not like I knew what it meant. It sounded medical.
Erythema.
Medical.
Yeah.
Dang.
Thundoris.
Pokemon.
Yep.
I don't even know
You're
my
good.
Pokemon is. I don't even know.
Carvedilol.
Pokemon.
That's medical.
Ah, shit.
Dang, what is it?
Blood pressure medication.
Futuron, it is the Jeremy Savage.
There we go. How about Carkle?
Carpool? Pokemon.
Pokemon.
Correct. Good job. You guys are. What is that like? 4 out of 5?
We're not Pokemon fans.
And
Not Pokemon fans, but people who watch a lot of Grey's Anatomy.
oh, I love it. There's not as much hanky panky going on in the call rooms, though. Trust me. Reniculus.
Say it again?
Reniculus.
Medical.
Are you sure? It's a Pokemon.
Oh, dang.
Pokemon.
Why would I think that was medical?
Don't ask me what it looks like. I don't know. Dreepy.
Pokemon.
Correct. All right, and we'll do one more. Onychomycosis.
Medical.
Did I already say that one?
I don't know.
I don't
They
think
all
so.
sound the same.
They do. They do. Where are you guys from?
Texas.
Love it. What part of Texas? Or you don't have to say.
DFW.
DFW. Oh, beautiful area. Did JFK really get? Was it that guy? The guy in the library depot?
Oh.
Wait,
Listen,
what?
I'm a conspiracy theorist, like on the surface.
Uh-huh.
So I don't really know a lot. Like I believe the Earth is flat, but like I don't know in depth.
You think the Earth is flat?
Yeah, I do.
Why?
I really do believe
You
that.
said a lie.
Because I watch a lot of TikTok.
Too
and
many
maybe I
pilots,
shouldn't.
man. Too many pilots agree to that.
Literally.
I wait. Too many pilots agree to that. Why?
Because they fly in the air and they can tell that it's flat.
So I actually personally know someone right now that's on the International Space Station, and I have seen the videos he's taken. So how do you make of that?
Well, I don't know because I've never seen it.
I can send you his.
Based on
So,
the
okay,
videos that I've
so
watched.
do you believe that the moon landing was like factual, was true, it actually
Hey.
happened, it was live?
That's a different argument, but let's look at the. So why is every other planet we look at round and spherical?
Listen,
Why would the Earth be
I
the?
feel like the way that they try to push things on us is real.
I have not enough knowledge to argue anything.
I don't either.
I,
But yeah, that,
like, why would we be the only flat one out there? Because we can physically look at the other ones, right? We know they're.
That's true, I guess. I don't know. I just watch a lot.
hey, hold on. Now I'm gonna have to go back.
Now the other question is, you said they're pushing it on us, but what's the you always got to follow the money. So where's the money in this theory? How could someone profit off of the Earth being spherical when it's flat?
Right. So the videos that I actually watched, it's funny that
Keeping
you
you
say
from
that.
certain places, you know, like
Yeah.
you're not supposed to go to Antarctica or not
No, I think that is.
or like
But why?
I don't know. That's what we want to know.
So there's no reasonable. So most conspiracy theorists, like, so the JFK conspiracy assassination, right? Like that makes sense because like the mobs were trying to keep JFK quiet, right? There's money there. But saying the Earth is flat to keep you from going somewhere for some unknown reason is just.
It's wild. Yeah.
It is.
I don't know. I'm just one of those people that
I
watch
love
a
it.
video and I'm like convinced.
I love it. Are mermaids real?
It's
What?
terrible.
Mermaids, are they real?
I don't know.
I don't know. Do you believe that they are?
No.
That's your question.
No. My wife one time seriously said, I watched this documentary and I'm convinced mermaids are real. And I looked it up just real quick and it's like, it said fictional documentary at the beginning. And I'm like, honey, you know this was fake. And she's like, I didn't read that at the beginning. So no, I didn't know.
That's me. That's me. Literally.
Honestly, the way you asked that question too, I was like, this guy obviously is researching shit. So if he's gonna ask me a question, maybe mermaids are real.
I mean, they could be, but I'm not convinced yet.
I said anybody else asked me, I would have immediately been like, no way. But also, I still know that there's a lot of shit out there that we have not discovered. As far as like species type stuff or whatever. Yeah.
That's true. That's true. We should have been battling this whole time.
That's what we should have.
So what kind of a doctor are you? Like, what's your specialty?
Have you heard of Dr. Oz?
Yeah.
I'm nothing like him. I'm a real doctor.
He's an actually complete opposite.
Yeah. No, anesthesiology. I'm a third-year anesthesiology resident. So I put people to sleep.
Yeah, I was about to say that.
Sometimes I wake them up.
There you go.
Nice.
I do the same, just not on that level. Not legally.
Not legally. I get you. You and Michael Jackson. I know what you're. Yeah. I get it.
That's really cool.
Oh shit.
So are these medical terms? Do you actually know them, or do you just?
Oh yeah. Let's see. I just generated a random list of medical terms. Let's see. Now I don't know all of them. Telangiectasia. That is like little red things on your skin. Craniopharyngioma. That's a tumor of your brain. Hemochromatosis. That's heme, iron, chromatosis. Or I'm sorry, heme is blood. Chromatosis is iron. Too much iron in your blood. Onychomycosis. Now that's the infection of your toe. I got confused. Glioblastoma, brain tumor. Pancytopenia is when all your bloodlines are low. Spondyloarthropathy is pretty much arthritis of your spine.
He's a doctor. Yes, he knows the terms.
Oh. All right. Yeah, I'm done.
I just wanted to hear him talk about him. I think it's cool.
That's one of our comments.
This is like real life Grey's Anatomy, okay?
Okay, I won't charge you guys a deductible if you have a medical question, but I can't diagnose you.
Huh. So did you, obviously you went to medical school, but was your specialty like you wanted to be an anesthesiologist from the very beginning?
Not at all, no. I was in the military for 8 years before I ever went to med school, but I wanted to do like physical rehabilitation medicine.
Oh, that's awesome.
Yeah.
So what made you quit?
Anesthesia is like really hands-on. You get to like do cool things, CPR, all the fun fun doctor stuff. And also when everyone's sleeping and everything's going well, I can play on my TikTok and crossword puzzles.
Might as well.
What do you guys do?
I've ran a auto detailing business for the last 5 years, so I just clean people's shit.
Nice.
I clean people's shit for a living.
Do you pay other people to clean people's stuff?
What's that?
Do you pay other people to clean other people's stuff?
So I've definitely been here within the last 5 years. You know, at times I've had 6 employees. Times I have no employees. I've had multiple crews, 1 crew. But right now, solo dolo, me and her tackle the jobs.
Sounds stressful, honestly.
It is.
Mm.
It is. It definitely has its lows, but it comes with the highs.
Thanks for the corn on the cob. Sorry, it was one of the gifts. Can you see the gifts that I get?
Yeah, they pop up like the bottom right.
Oh.
Like over your...
I'm new to this. I'm such a loser. Would you guys go back and do it again?
Folex for seat stain remover, Avery. What's that?
Would you go back and do it again?
Would we go back and do what?
Yeah, you open up your business, do the detailing.
I would definitely do it differently, and I don't know if So I've always been OCD.
You're like that.
Whoa.
It did.
No, I mean, it's kind of a calling type thing in a sense. It's just made sense. It's always what I've done.
Thanks, Thomas, for the follow.
But as far as like structure, planning, and long term, I don't know if I'd do it again. I wouldn't do it how I did it, for sure.
What would you do differently?
I would definitely start off with actually like trying to learn the business side first. Not just thinking it is a trade of service, but that's very small.
Yeah.
You know, that keeps you, you're just working for your business. You're not running a business and stuff, and it just kind of keeps you small.
Got it.
So having to learn business while you're dependent on the business.
Is that kind of like learning to swim when you get thrown in the water and you're drowning?
Literally. And you learn. You do learn a lot quicker. But you do fuck up a lot more often. You know. So we lost. Dang, you're the first person
Dang,
we
you
lost
like
to.
really beat us.
Oh, really?
Holy crap! You like kicked our butts. Oh my god.
I love you guys. They're the best. These guys are the best. I think they went into debt to help me win. I feel bad.
We appreciate the freaking you being normal.
I was about to say, just the normal conversation was glorious because
We're gonna practice in the last few slides.
The last guy, I'm pretty sure he was hilarious, but I'm pretty sure he was tweaking. Like, dead serious.
Well, it is midnight, so
yeah, that's true. But last night we had you explained because it's funny when you explained it. Mary.
Oh, Mary, yeah. She was drinking coffee and she didn't speak at first
At
for
like
the first
midnight.
5 seconds. And when I asked why she was drinking coffee, she responded with, "It's water." Deep voice. It was a man.
And then there was a button next to the name, and we should have seen it, but we didn't.
I had to run out of here.
Yeah, he did. He literally got up and walked out of the camera immediately.
We're loud, man.
I didn't know how to disconnect people.
Neither do we.
And
Still don't.
You just have to screen doing this.
I was like, me and this other person, they were new too, and we were both trying to figure out how to kick each other off. Someone told me, if you click host on the bottom left, and then on the top right, there's like a door that's like an exit.
No, that's just what I do every time, but I feel like there's got to be an easier way.
Oh,
Hey, what branch of the military did you serve in?
So I started off in the Army. I did 4 years, and then I switched to the Air Force, and I did 4 years. And now I'm in the Navy, actually, and I'm a physician for the Navy.
So would you have done...
Thanks for your service.
Yes, thanks for your service.
Appreciate it. Thanks for the support, guys.
Would you have done it the same?
It was life circumstances that led me to this. I definitely would have served in the military. I was in the EOD, and I loved that. I was planning on retiring, but it was the life circumstances I found myself in that led me to my path. You know, it was kind of like you said, a calling, right? Like God led me to medicine and shut a lot of doors to put me here. So I think so.
Yeah, I was gonna say it does always. Even though we say we would change things, we're like, who knows where we would have ended up. So it's really hard to say that.
Yeah.
Well, thanks for us. Thanks for. I mean, we lost, but
Yeah.
Thanks for beating us.
some losses are worth
kicking our
it.
ass.
Okay?
Anytime, guys. And hey, chat, they're kind of weird, so I'm gonna leave. No, I'm just kidding. You guys are awesome. Have a good night.
Bye, you too.
Guys, it's way too late for me. We stayed up way too late, and I didn't do a sub-only chat. I'm so sorry. Let me just do that now. I can stay up for another 20 minutes. I'll stay up for another 20 minutes because you guys are worth it. You guys deserve it. My bedtime's 10:30. I have a history degree, but have become interested in the medical field, public health. Do it, Heather. I know I just shut down the chat and you can't respond. You can always DM me, but yeah, don't let us stop you if that's what you're interested in. Hides, how have you been? I have a history degree, but we just answered that. What's going on, Ashley? Hey, Ashley, I tried really hard, and if you want to come on, I will try and have you on as a guest. But it wasn't working. Would you like me to try again? Hang on, I got to get better lighting, y'all. I feel so dark right now. Lots of infusions through my port, but all good. All. Let me see if it works. Oh, there we go.
Hey.
Okay, that's not gonna work. What's up, Ashley? How are you?
How do you do the camera?
I don't know. Usually there's a little.
Wait, camera. Hold on.
There's a lot of noise in the background.
Yeah, it's the TV. Hold on. Is that better?
No, I hear
The volume's
everything.
not going down on the TV. Is that better?
Yeah. Oh yeah.
For some reason, my TV is extracurricularly loud.
Extracurricularly loud. I love it. That's funny. That's funny. Do you want to do the game or do you just want to chat?
Yeah, either one. It doesn't matter.
Let's start with the game.
Okay.
Lichen planus.
Pokemon.
Medical term.
Oh man.
It's a skin disease. Quaxley.
Pokemon.
Pokemon. Fido.
Medical.
Pokemon.
Oh, I was gonna say Pokemon.
This word's hard to pronounce.
You're getting me on these. I was getting them all right when you were doing with other people.
And Mindy could be correctly right. I could be getting all of these Pokemon names wrong. Like how do you say Fido? Fidouugh. Fido. It's like Fido. Fido? Oh, Fido. Okay. Corvi Knight.
Wait, say it again.
Corvi Knight.
I'm gonna say medical.
Pokemon.
Oh God, I was gonna say Pokemon.
Oh, let's see. Let's see. Any other subscribers want to jump on, by the way? Let's see. I'll invite them.
I'm one of your mods, but I never know when you're on, and I always miss you.
I never know when I'm on either. Usually it's Pacific time, sometime between 7:30 to 9 p.m.
Well,
That's.
I've been seeing you lately, so I've been catching you, but
Oh,
I
good.
haven't caught you in a really long time.
Well, I'm glad to hear from you, Ashley.
Yeah,
Anything new going on?
Huh?
Anything new going on?
Oh look, I got my camera on.
Oh, there we go.
No, I've just been having a lot of health issues, but everything's gonna be all right.
I love the positivity. Parenchia. Pokemon or medical term?
Pokemon.
Parenchia is a medical term, and I've never heard this term before. I had to look it up. Bacterial or fungal nail infection of the hand or foot.
Oh, I've never heard of that.
I don't know why it differs from onychomyosis. Onychomycosis, sorry. All right, Mindy, you can chime in here. There is a way I think you can get notifications if you guys want to subscribe to the lives. I think if you click my profile and there's a bell at the top right or something. You did that and it doesn't notify you?
And I don't get any notifications. I think it's a TikTok thing.
I see.
Yeah, it doesn't work. I'm with Hides.
Well, that sucks. I'm sorry.
Hey, Mindy, you can talk if you want.
Oh, I wasn't sure